Did you know that over 1% of children in Wales are now in care? These children often face huge disadvantages and have worse outcomes in education, health, and employment than their peers. Only 6% of care leavers in the UK are in higher education, compared to their peers, who are 47% in higher education. But not only that, adults who are in care in childhood are 70% more likely to die prematurely compared to those who are not in care. Now, I ask you to imagine if you're a parent of a child in care for reasons beyond your control. Every day you worry about whether your child will thrive or whether they will be left behind. But you are told that research can help us understand why children in care are more vulnerable and what we can do to help. But there's a catch. They never ask you, the parent, or your child, what matters to you, what your experiences are, and what you think about the research. How effective do you think their research can possibly be?
At the National Centre for Population Health and Wellbeing Research, we ask ourselves, how can research make a difference if it doesn't start with the people it's going to affect? Research is powerful with the ability to change lives, but research only matters when it's relevant, and it's only relevant when the individuals it seeks to help are placed at the heart of the research. For research to be impactful, it must be grounded in the lived experiences and needs of real people. This is where patient and public involvement, or PPI, come in.
PPI is the cornerstone of our approach, ensuring that patients, carers and families don't just participate in research, they actively shape it. Let us tell you more about it. Involving people in research in a meaningful way is no small task. It involves a real commitment of time and resources, as well as, most importantly, a genuine willingness from all parties to listen and adapt. PPI must be embedded throughout the entire research process, right from the beginning, starting with writing the research proposals. We have co-developed a series of grant writing workshops. During these workshops, researchers and members of the public meet to discuss ideas for research and different research proposals. But our workshops are different. We don't just give feedback, we take the lead in discussions, chair meetings, and actively shape the direction of the research. This approach ensures that our voices are heard and that the research truly reflects the needs and perspectives of those it aims to benefit.
Since 2022, our group has been part of over 20 health and social care research grants. We've had 16 of them successful, which has brought in over £8 million worth of funding to Wales from 2022 till now. As an enthusiastic member, let me tell you more about how we make a difference. When discussing research proposals and ideas, we make sure that the research questions truly reflect the needs of our communities. We make sure the proposed methods are ethical and meaningful for the people at the heart of the study. For example, we ask researchers, is the research being done just to fill a gap in the evidence, or is it being done to address a real need?
We take a careful look at how participants will be recruited, how information will be shared, and how consent will be obtained. So everything is transparent and inclusive. So, for example, have researchers considered the needs of people who might not be able to give consent for any reason? And have they considered how to still get these participants included? How is the language used to inform people of the research? Can it be easily understood so people know what they're signing up to do?
We assess the strategy and level of public involvement in each proposal, ensuring it is authentic and meaningful. But we don't only consider at what stages patient and public involvement is being proposed, but also exactly how those people's insights will be incorporated into the research. For example, does the PPI strategy really allow people's voices to shine through? And do they have a say in how the findings are interpreted?
We advise a dissemination strategy that is appropriate to reach the communities we represent. For example, instead of an academic article, a fun, co-produced cartoon is more appropriate to reach children and parents.
Most importantly, and in alignment with our commitment to ensure individual voices are heard, we have and continue to advise on strategies for sharing findings, always emphasising impact, equality, diversity and inclusion at every step.
Let me give an example. One of the first grants we developed as part of these workshops investigated why children in care are more vulnerable and have worse outcomes than their peers. Our PPI group emphasized the importance of co-producing research with those children and parents, and for the voices to be heard, not just at the first start, but throughout the entire research process. I'll tell you that this approach did not only improve the quality of the research. Our PPI group, they were actively involved in shaping the research questions and the scope of the research. Now you might be wondering, so what was the impact? Well, the involvement of children and their families in the research actually helped us to understand why children in care and the risk factors for care entry are so deeply interconnected. And these insights alone fundamentally shifted the direction of their research. So it helped the researchers to understand that they needed to take a more holistic approach to understand and address those issues.
So I ask you, what would happen if every research project started with patient and public involvement? How much more impact could we have, and how much more meaningful would our studies be? How much more representative of the people we're trying to help will we become?
We've seen the power of putting people at the heart of research. It's time to make this the standard, not the exception. Research matters, yes, but it matters most when it's driven by the voices, needs, experiences, and aspirations of the people whom it impacts. Before we take any questions, we just wanted to take a moment to acknowledge the researchers' willingness to work with us to ensure the best and most useful research is done.
We'd also like to thank those members of the public willing to contribute their experiences and their time to any aspect of health and social care research. Without your courage, generosity, and altruism, the incredible advances that we've made in technology that allow all of us to live longer, healthier, and more fulfilling lives wouldn't have been possible. So we challenge you to start your next research project by involving PPI. Let's make this change happen together. Thank you.